Welcome, and thank you so much for joining today's Digital Doc conversation on fertility. We are joined by Dr. Ioana Manahilova from the Aligned Modern Health Functional Medicine team and Rania Abu-Samra from the Aligned Modern Health Acupuncture team. We are so pleased to share this information with you, and we appreciate your time. Please note that this conversation on fertility is for everybody. Everybody has access to healthcare with Align Modern Health and is welcomed into our services. Before we get started, we'd just like to introduce Align Modern Health, a little bit about who we are and what we do, just in case it's your first time joining one of our Digital Doc webinars. Aligned Modern Health is the Midwest's top-rated integrative medicine health and wellness service provider, where we really aim to get to the root cause of why our patients are feeling what they're feeling, and not just focusing on one siloed symptom or condition. We fully recognize and appreciate that each of our patients is a whole person with a whole system of body, organs, and efficiencies, and everything works together so that we can really maximize the outcomes of our treatment plans. We work integratively through several different core services, including physical medicine, like chiropractic care, injury prevention and rehabilitation, athletic performance support, and clinical massage therapy. Our acupuncture program absolutely supports physical pain, but also some more intangibles like stress, anxiety, depression, sleeplessness and insomnia, men's and women's health and hormone balancing, seasonal allergies, gastrointestinal and neurological disorders, and we do have a nationally recognized fertility support program. This practice is also supported by some other modalities under the Chinese medicine umbrella, like customized herbal medicine, cupping, and moxibustion. We round out our services both in clinic in the Chicagoland area, as well as via telemedicine in several US states with our functional medicine and clinical nutrition practice. We like to say this is a great practice to do a deep dive internally to better understand why you feel what you feel externally. We support gastrointestinal issues, autoimmune disorders, bloating, constipation, fatigue, migraine, food sensitivities, hormone balance, everything under the sun with men's and women's health, and of course, fertility and pregnancy support. This practice is also supported by nutritional counseling, and we are so pleased to have Dr. Ioana Manahilova and Rania Abu-Samra from our functional medicine and acupuncture practices, respectively. Aligned Modern Health is in network with most major insurance programs, and we also offer free consults in case you have any questions that you'd like to discuss one-on-one with a provider before becoming a full new patient. Speaking of questions, you are absolutely welcome to ask your questions to Dr. Manahilova and Rania today. Please type them in at any time in the Q&A section of Zoom. The Q&A feature is the little icon that has the two conversation bubbles, and we will be happy to moderate and address questions at the end of the conversation. All of that said, it is my pleasure to welcome our providers.
Hello, everyone. My name is Dr. Ioana Manahilova. I am as Janine mentioned, functional medicine provider here at our in-person Southport, Lincoln Park, and Lincoln Square locations. So pretty dispersed throughout the city. I do have a Bachelor's of Science in Human Physiology from University of Iowa, go Hawks, and I do have a doctorate in chiropractic from National University of Health Sciences with additional postdoctoral studies in both functional medicine and functional neurology. As far as my overall background, I was actually born in Bulgaria and was raised with a initial Eastern medicine mindset and moved to the States when I was younger. So I was able to be exposed to both Eastern and Western medicine and love the combination of both. My clinical passions include neurological concerns, at the forefront currently being long COVID. I do also see patients with autism, Parkinson's, Alzheimer's, general cognitive impairment, and post-traumatic brain injury. Any form of gastrointestinal concerns like IBS, bloating, SIBO, candida, and some food sensitivities, brain fog, hormone balancing, especially as it relates to fertility, and fatigue. We also have Rania on the call today, and she will be introducing herself.
Thank you, Dr. Manahalova. Hi, everyone. My name is Rania Abusamra, and I'm a licensed acupuncturist and herbalist here at Align Modern Health in our Logan Square location. I have been working in healthcare for about 11 years now with a background in mental health. And I slowly transitioned to Chinese medicine because I was interested in expanding my scope of practice and creating a more holistic practice. And so yeah, I am super pumped to be here today, and some of my passions include treating digestive disorders, respiratory concerns, men's health, reproductive issues, musculoskeletal pain, mental health concerns, and of course, herbal medicine. Before we get started, Dr. Manilova and I have had a chance to connect, and we were wanting to focus on a very interesting intention today. And I think we get this beautiful opportunity day in and day out to work with a diverse population of patients. And that makes us really excited. We get to reach so many people. And whenever we're working, especially when it comes to fertility, we really like to center the idea that really families come in so many different forms. And the roads to parenthood are vast. So regardless of the family structure, the interventions that people are taking, the ways that we're conceiving, our identities, our age, the complexity of our issues. At the end of the day, what we're really interested in is just providing a safe environment for people to be able to grow, because yes, it's important to reach our goal and start our families. And it's also important for us to be able to support people to do that in the best way we can. So I wanted to make sure we emphasize that before we get started.
Yeah, that is a great way to start this call and a great intention. When we think about infertility or just fertility in general, it's important to note that as of April of 2024, the CDC has indicated that general fertility rates had actually decreased by 3% in 2022, reaching a historic low, and it was down another 2% in 2023. Birth rates did also decline in all age groups for females from 15 to 39. C-sections are also on the rise, and there's a preterm birth rate of 10.41%. So a large number of people are affected by issues as it relates to their fertility journey. When we look at functional medicine as a whole and how we support fertility and hormone balance in general, we really like to take the personal individualized approach. We do that by doing a very extensive health history, medical history, and making sure we get all those little details into what brought you to our doors today. Also, we do extensive blood work testing, and we have access to a number of additional functional tests that can include anything from genetic testing to GI testing to even neurotransmitter testing. So we want to make sure that we're getting the full picture of what could be hindering, or even if it's the first time that you're entering the fertility journey, we want to give you the most information that we can so that we can optimize the outcomes that we are looking to find. Functional medicine sees all aspects of the fertility journey, whether it's your first go, whether you're in an IUI or a IVF treatment, whether it's your second or third child, and you want to just make sure that your pregnancy is as healthy as possible. We also really focus on health, both through the fertility journey, but also during and after, right? We want to make sure that the quality of life maintains during that time. One of the biggest things that functional medicine focuses on is measurable outcomes. So we really want to make sure that not only are you subjectively feeling better and achieving that goal, but also objectively, we're seeing that reflected through the testing that we do. How would you say that acupuncture touches on those same aspects, Rania?
I want to echo your sentiment in a lot of ways, because we get this beautiful opportunity to work together in general as our teams do. But yeah, and it's true. We do work. It's about the journey, and it's about the many journeys. We're using individualized forms of care, right? So we're not really just working on looking at people as numbers, but we're looking at people as individuals with different environments if we must. Like we have living environments that are around us and within us that we're trying to regulate. And so from an acupuncture standpoint, then yes, of course, we're looking at working from people who are trying to conceive, to pregnancies, to live births, to supporting people postpartum. So like it doesn't just start and end somewhere, really. Like and like ultimately what we want is people to live their fullest lives. Like once you give birth to a baby, it's not or you just have a baby, it's not the end all, right? Like there's just much more that still needs to get done, and we care about all of these steps. And so acupuncture can be really helpful with that, because I mean, it's been used for thousands of years to regulate cycles, to support with ovulation, egg and sperm quality production, fertilization support. We're talking about IVF, IUI support, endometrial lining support. I mean, we can keep going and citing all the things that acupuncture can do, but it's just been pretty effective at supporting patients through their fertility journeys. And I think you touched on a really important point that we like to emphasize, and that is it is evidence-based. And it's an evidence-based practice. And I mean, we're pretty excited here because we've had this wonderful opportunity to be supported by a study that was done by two incredible clinicians in our team, Dr. Lamia Kamel, our director of the acupuncture team, and Dr. Kate Philippi, who have put together a study looking into the effects of acupuncture on fertility. And through their study, they were able to actually conclude that the rates of actual pregnancies, clinical pregnancies, were higher through individualized care with acupuncture, and live births too. The live birth rates also did increase when they were able to get acupuncture pre and post embryo transfer. So, I mean, for us, this is pretty exciting. And of course, the literature outside of that also exists, and it's very, very evidently effective.
Yeah, I think research is one of the best ways where we can continue to highlight just how effective these strategies can be, both for functional medicine and for acupuncture. One of the most common questions that I get in my practice or during my free consults or with patients in general is, well, I have this, so is it still possible for me to go through this journey? Or, you know, I have tried everything. How is this different? I think that individualization is what makes it a little bit different. As I mentioned, we do testing that looks a little bit different than you would have even through a reproductive endocrinologist, your primary care, your OBGYN. We look at what hasn't been looked at yet, right? So genetics is one of those big ones that we're really focusing on, because we love to continue to utilize all of the advancements that modern medicine has to offer. And we also focus on specific needs to your body, right? For a body to be able to go through the process of creating life, it needs to be in its optimal health state. So what that means is we look at any kind of secondary causes that may be contributing to where you're at in your journey. Or again, if you're just coming in for your first time and you just want to optimize that health before you start your fertility journey. Or another common thing I often see is for patients who are getting off of birth control and want to optimize that since they've been on birth control for a long period of time, what that would look like. And the nice thing is we're able to track, right? We're able to track what your metrics look like when you come in and as we make these changes. So we're able to see patients who have concurrent ongoing infections or immune issues, metabolic issues, PCOS, anovulatory cycles, dysmenorrhea, PMS, and even severe nutritional deficiencies. And we work on combining diet, lifestyle, supplementation, and integrative with specifically acupuncture. But if there is also pain, we utilize that physical medicine team. We have that wonderful nutrition counseling staff on hand, so we can really also break down the diet component of things. I know as we start to get more research out about women, which I'm always so excited about, we're coming to find that we're exposed to so many more toxins than we initially thought. I know one of the most pressing concerns as of late for my female patients that are coming in for fertility patients or just general health, they just found heavy metals in tampons, right? And that's something that we often use at least monthly to be able to support us through that cycle. So to find that something in our environment could be causing such disruption. And that's how we continue to modify the plan. And that's why, as Rania had indicated, it's not just a, well, we got to the accomplishment of having that successful birth, but making sure that you are supported before, during, and most importantly, after. And I think acupuncture does a great way of also really focusing on some of those additional ongoing issues that could be happening at the same time.
Yeah, I really love what you're saying, because I think like a lot of us are so divorced from our bodies these days. And I think that like we find ourselves in situations where we don't have as much awareness of our bodies, or we're bombarded by so much information, all these fads out there that are telling us what to do with our bodies and all this stuff. And I think like our patients generally get this opportunity to be able to kind of sort through this information and build awareness, because we all have like an intrinsic ability to tell what's going on in our bodies. And I have like impressively aware patients that show up that are like know their bodies, but are trying to organize this information in a way. And like you know, having the blood work for FM, for instance, and us being able to look at like pattern differentiation and diagnosis, and being able to understand the patient through our line of questioning allows us to create a very individualized treatment plan to be able to support the patients. But yeah, like that, building that awareness, I think it's very helpful during building the awareness and working with the already existing awareness. Because I mean, so many people are aware of what's going on, you know, and are coming in with enough information. They're just looking for a treatment plan. You know, they're looking for support while they're going through on their through their journeys. And so I think that's I think we can come in with a lot of different tools to support them with that. Yeah.
Yeah, and you brought up a really good point, is that bombardment of information, right? Social media is great because it makes us aware, but in a sense, it can be also very overwhelming because there's just so much out there. And sure, all of those things can be supportive, but are they the right thing for each patient? And that's where we come in and help differentiate what you'll need for that specific support using those measurable outcomes with blood work or diagnostics. That also brings up a really good point with stress and the autonomic nervous system, right? We know that in today's world, we're always stressed, whether it's those outside stressors, right? We're living in unprecedented times, and that can be really stressful for a number of people, myself included, but that doesn't even begin to get the full picture of those internal stressors. More and more often, we're finding that there's a lot of toxins in our environment, in our food, in our water, in our air. So even if you are doing all of the right things, which is, again, a common patient base that I do get, I've tried to change my diet, my lifestyle, but I'm still finding that I'm going through these issues. How can we go in and support that detoxification process or that stress response process, right? Unfortunately, the body doesn't know the difference between it being chased by a bear and having work stress because you're working 10 to 14 hours, right? Stress is stress to the body. Even something as beneficial as exercise is still stress, albeit it's short term and it tends to be more positive. It is still a stressor that we need to look at, and we need to create a protocol where that exercise or that diet or that lifestyle fits within those parameters of, let's make sure that that stress is being lowered in any way that we can possible, right? And I know that the stress and autonomic response is really important to acupuncture as well.
Yeah, no, definitely. I mean, I think you're touching on, again, very important topics. And I think like we completely, like we always talk about the effects of cortisol now on our health. Like it's just like we can't not address that. And I think you know, we get like a beautiful opportunity with acupuncture to be able to lower cortisol levels and actually address the autonomic nervous system very directly. And I think, I mean, just going into what the autonomic nervous system is, it's a system that is self-governing, that exists within our bodies, that is operating independently from our thoughts. So if there's a system that exists already in our body that is trying to regulate us, do we work with it or against it at the end of the day? Right. And I mean, what we want to do here, and especially, well, in terms of fertility, is support people to be able to get through their journeys and, you know, meet their outcome, right? In order to do that, we need to be less stressed. And so the autonomic nervous system has two systems to it, right? So the parasympathetic and the sympathetic. So what we're trying to do here is we're trying to reduce the sympathetic response, because that's where, you know, your cortisol levels do increase, but vasoconstriction does also increase, meaning we're actually getting less blood flow into parts of our body that would allow us to be, that would allow us to have a healthy, fertile journey, right? Versus actually struggling with that, and not being able to and I think I'm getting into too many details around it, but like when we're talking about the parasympathetic system, on the other hand, we're trying to actually get ourselves into the rest and digest system. And the rest and digest system allows us to also bring more blood flow into the uterus and less into the limbs, right? With the sympathetic system, we're trying to run away from something. I know we've talked ad nauseum about the idea that you know, we're always running away from something in life, whether it's, you know, this idea of a bear that we're running away from. There's just so much stress going on, so many obstacles. People are already struggling. Like if people are coming in already having tried so many things, right? Like our nervous systems are a little shocked. And so when we're coming in, we're trying to activate the parasympathetic system, the rest and digest system, so that our bodies can heal, our bodies can make better quality eggs and sperm, and can actually support us through this journey.
Yeah, and you touched on a very important topic with that. Emotional health is a very big component of what we aim to do from a functional medicine standpoint, and even just myself as an individual provider. My biggest goal is to educate my patients in a way where they're able to understand and they're able to become more prophylactic about their care, right? Today, we're more in a reactive healthcare setting, and we really want to start to focus on, well, we want to get to what's going on at the first sign of symptoms. We don't want it to build up on top of it one another, because as you said, the cortisol is already there day to day. Even if we feel we're at our calmest, just being in the environment that we're in, exposed to all the toxins that we have, those are internal stressors that do affect fertility. We also have to consider the other hormones and how they're affected by cortisol. Cholesterol is the precursor for all of our sex hormones. It is also the precursor for cortisol. So cortisol, whether it's high or low, right, can negatively impact the production of progesterone, FSH, LH, testosterone, estrogen even. So it does go to say, biochemically, cortisol is very much related to that. But we also have to consider things like insulin, right? How does insulin affect the hormone patterns? How does it affect a cycle? And then there's also thyroid involvement. We know a lot of these more chronic ongoing issues are on the rise as well. And that's where functional medicine and acupuncture are so aptly trained to be able to work on multiple issues at the same time, because we are just trying to figure out what that root cause is in the first place and eliminate that root cause so that we can create that overall better health.
Definitely. Yeah, because I mean, what we end up doing, a lot of our work is trying to understand like the little details that connect to some of the symptoms that people are experiencing, right? So like if there is an insulin regulation issue going on, are we like, is it connected to the fact that someone's not ovulating? Like, are we having issues around bleeding mid-cycle? Are we talking about progesterone issues? And so looking into that in depth, whether through like the blood work that you do, and then through us being able to look at people's patterns and understand how we can actually treat patients. So I think it's important to I think like emphasize the fact that patients will come out with more information and be able to get more answers and support. And I think another important thing to talk about too is that it's not, unfortunately, it's not a magic pill. you know, like we do have a lot of answers, and we have worked with many patients, but at the same time, it is a journey of patience also, in that we get this opportunity to go back and forth with patients and really grow on their journeys and be able to witness them through cycles sometimes, or through, you know, IVF treatments or whatever it is that they're going through. And through those cycles, then we get more and more information, and we try different methods, and we're able to utilize the tools that we usually use, whether in my case it be herbs or acupuncture, to support the regulation of hormones, to increase estrogen if need be, to support LH surge, or whatever it is that we're working on. These are it takes an amount of it takes an amount of people that are able to show up a little bit for practice, and for us to show up, and for them to show up equally. And so I do like to talk about that too, because it's an important part of our practice too.
Yeah, I think you kind of really touched on, depending on the complexity, right? It may take a little bit more time. We have patients that are coming in and haven't tried anything else yet. We have patients that have tried everything and are coming in and want potentially maybe an answer that hasn't been looked at yet. What I have seen is that the time varies, right? It can happen more quickly. It can take a lot longer, depending on what we are trying to resolve. We also want to make sure, and I always want to touch on this point, is I have seen ongoing frustrations with some of my patients where, like we say, right, once we get you through that fertility journey and you're in the process of that pregnancy, oftentimes patients feel like they're very limited in their capabilities of, you know, something they can take. Before, you were able to just take a, you know, gas X or, you know, or whatever it might be over the counter, and you didn't have to worry, where now during pregnancy, you're limited to what you can do in the event that something comes up, whether it is a metabolic concern, right, gestational diabetes, or whether it's something that you've never even had prior to pregnancy and are now struggling with. Both functional medicine and acupuncture can very much adapt to, I mean, pregnancy is a special population for a reason, to that special population, and utilize our pregnancy safe supplements, and then continue focusing on diet and lifestyle during that time, so we can continue to help support that optimal health of not only the person carrying the child, but the child itself. And we really want to make sure that we're ensuring that, because going back to, again, stress, right? Any stress on the body during that time is going to be reflected in both the person carrying and the child potentially. So we want to continue that ongoing support, decrease that stress overall, and continue to modify and measure those outcomes with the blood work that we have access to, or any other testing that we deem fit. So a very adaptable plan throughout the entire fertility, and once fertility has been achieved, pregnancy and even post-pregnancy journey is kind of what we're aiming to achieve.
Yeah, ultimately we're carrying the weight here with people, you know, like we're asking them to give us the weight, their stress, and give us all the thinking that they're doing on the side. And we're creating a community of healing, because I mean, a lot of us in this space really do believe that it takes a community to heal, that we have the resources to do it, but that we need to all work together to be able to show up for people, whether it be through, you know, like you said, reducing the stress in the moment. Because I know, I mean, people coming in again are going through a lot, you know, most of our patients are. And so just being able to let them know that here, like, this isn't you're not alone in that we're here, but also you're not alone in that we see so many patients that are coming in maybe with not the exact same issues, but very similar themes that we get to witness. And so we see people through cycles, and it's kind of interesting to be able to walk through those cycles with patients and be like, okay, so you're in this part of this, and now you're moving into the next cycle. And just noticing that as humans, even though we're different in a lot of ways, we still have similar ways of processing things. systems and our bodies function in some ways similarly. Like we're just trying to create a new baseline here. Like we've created another baseline by dysregulating ourselves with how we reacted to our systems out of survival. And now we're saying, here, we have all these wonderful tools that can allow you to create a new baseline that would allow you to be living the life that you want. Away from fear and more into just feeling gratified and excited about opportunity.
Yeah, and I mean, we don't really need research to say, even though it does, that community healing is more powerful, right? When we're in our communities, whether it's our friends or families, or in the sense of healthcare providers, most of my fertility patients, if not all, have a team, and that's what our goal is. Even if that team is outside of AMH and outside of functional medicine or acupuncture, my goal is always to combine that team so that you feel as a patient that you are advocated for throughout the entire journey. So we do work with different providers with our patients, right? Whether it's their longstanding PCP, their OBGYN, midwives, doulas, outside endocrinologists, reproductive endocrinologists. These are all providers that we do work with and try to line up our treatment plans so that they do create, again, the most suitable outcome for the patient itself. So we do love to have that integration even outside of AMH.
I feel like you kind of summed it up beautifully. Did you want to add anything else? I feel like I'm good here.
No, I think we've kind of really touched on all the important topics as it relates to fertility. And if there's any questions, I'd love to answer those.
Thank you so much, Dr. Manahilova. Thank you, Rania. We really appreciate everybody that has stayed for the entirety of the conversation as well. This is a great time to type your questions into the Q&A feature of Zoom. Again, the Q&A feature has the two little conversation bubbles. If you have any questions that you prefer not to ask in front of a live audience or on a recording, you are very welcome to give us a call at 773-692-6700 and request a free 15-minute consultation, either with one of our licensed acupuncturists or one of our functional medicine physicians. You are also welcome to visit us and request that free consult online at alignedmodernhealth.com. Again, please go ahead and type your questions into the Q&A feature of Zoom. I really appreciate the talk about being a journey, right? Fertility is one journey. Pregnancy starts another journey. Life after pregnancy starts a third journey. And we do have a question here. Once somebody has gone through pregnancy, has successfully conceived, and their blood pressure has changed. Dr. Manahilova, are there ways that functional medicine can support high blood pressure that perhaps was caused by pregnancy?
Yeah, absolutely. So that is one of the more common things we see as it relates to patient population, at least in my practice, is seeing patients post-pregnancy because that pregnancy may have changed what their body looks like after. So we tried to figure out what recalibrated during that time and is now causing, or the new root cause to that blood pressure. And as far as blood pressure goes, it really could be caused by a number of different systems. So we take a look at all of those systems, not just one, to make sure we're ruling out any of the potential issues, whether it's hormonal, whether it's cardiovascular, metabolic, or even stress related, because pregnancy on the body is 9 months of stress, albeit good stress, but still stress.
Thank you so much. We do have a question here regarding autism. I might suggest that this would be a great question for a free 15-minute consultation so our providers can better understand the background and the specific situation that this question pertains to. So we would suggest a free 15-minute consult for that. A great question, but we would just want more information whereabout it's coming from and maybe some background info so we can best address that for you. Thank you so much for that question. It looks like there are no other open questions in our webinar live currently. If you are watching this as a recording and you do have questions, again, you are very welcome to request a free 15-minute consultation so we can get those questions answered for you. I believe that brings us to the end of today's webinar. Again, thank you so much for joining us. Thank you, Rania. Thank you, Dr. Manahalova. And thank you to all of you in the audience. Thank you so much. Have a great day. Cheers.